Time now for another edition of Wellness Wednesday with Dr. Bradley Meyer at the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Hey, good morning, Dave.
We always have a lot to talk about, but we need to go back today and talk about the power of ozone because it has been proven to be pretty incredible.
Over the course of the last 18 months to maybe this fall, maybe 2 years, where we've been utilizing this modality, and it's 3 oxygen molecules or ozone. So you can do a quick search on the computer about it and learn all you need to know about it, but it's important that you source the right search on the computer because this stuff, there are practitioners that have been utilizing it across the world, across this country for quite some time that has left me flabbergasted at the effects of it in such a powerful way. I'm part of the AAOT, the American Academy of Ozone Therapy, which Dr. Frank Schallenberger has started years ago. He's the godfather of ozone. And the cool thing with ozone therapy and a lot of the providers that utilize this tool across the country, like hyperbaric therapy that we do here at Okoboji Wellness Clinic, the ozone therapy seems to rise the tide in a good way for a lot of different areas of the body that are out of balance. And so when you add in this approach, it seems to modulate the immune system, activate the mitochondria, which then bolsters energy. It is an absolutely phenomenal tool that should be in everybody's doctor's office. From a pain management perspective, from a chronic disease perspective, where we are looking at imbalance in different body systems, it is working to dial back inflammation. And so when we get folks coming into the clinic, as we always talk about, Dave, the toxin teeter-totter, we are trying to identify the organ systems or the body systems that are out of balance. And many times by the time folks get to us, 4 or 5 of those systems are out of balance. And so sometimes if you're just addressing one body system at a time, it may not be as fruitful as addressing multiple body systems at the same time. So that's what makes hyperbaric therapy and ozone therapy so helpful. Again, all those things are doing is supporting imbalances in the body through different mechanisms that have many different science and evidence behind them. Specifically, along the way we had talked to mitochondria all the time, but you can do PubMed search on ozone therapy and hyperbaric therapy and identify all the things that these things do just for the mitochondria.
Yeah.
So if you're looking at the toxin teeter-totter and all these different organ systems that may be out of balance, why we do the detective work, Dave, to determine is it the gut, is it the hormone system, is it the detox system like the liver? When you're applying some different approaches and adjusting our lifestyle, cleaning up our diet, we can activate some change in the body where folks start to notice, in many cases, less pain, many cases, more energy, and then that provides them a lot of hope.
Yeah. One thing that is pretty remarkable to me, if you look back at modern medicine over the last 20 years, when you've been in the doctor office, when has the terminology of mitochondria even come up? Now it's coming to the forefront of medicine, mitochondria, inflammation, immune system support. These are things people are finding out if they can tone down inflammation, if they can get the mitochondria, the body does a remarkable job of healing itself.
Yeah, absolutely. So that's the job of us here at the Okoboji Wellness Clinic, is walking alongside you, is to work on those things and identify what tool we think might be the best approach for you to move forward and then identify those areas of imbalance again.
Now, I want to talk about the lady that was headed for back surgery, and she, before going to back surgery, decided, I'm going to give this Prolozone injections a shot, so to speak, pun on words there, and it worked.
Yeah, it's an option for folks that are thinking, I want to exhaust every option potentially before surgery. And again, don't get me wrong, there may be a time and a place absolutely for surgery, specifically when we're talking joints like orthopedics. When you're bone on bone in a joint, that is pretty difficult to restore that joint without surgery. Now, that being said, I have had some folks with some pretty severe arthritis in their joints getting close to bone on bone that they want to try ozone therapy or Prolozone. And we have had some folks that have had some significant response to that in a positive way. So they're like, I prefer to maybe if I can hold off surgery longer, I'm game for that. And in the individual, the gal that came up from Southeast Iowa, she was a poor surgical candidate at that time. She had anemia, and which is a low iron count. She said, I want to try this. And over the course of about 3 to 4 treatments, she's at a point now where she's left with basically a little bit of stiffness in the mornings, but to the point where she was talking back surgery prior to that.
Yeah, it's pretty remarkable. And so for people that maybe, especially weather related, you have pain in the joints, maybe they've had past knee surgeries and their knee becomes bothersome, surgeries in the past wherever they might be. Like you mentioned, arthritis. A lot of people have problems in the wrist with arthritis. We want to make sure that people understand there's different ways to have ozone, not just IV ozone.
Absolutely. It can be applied in a multitude of ways. We had an incredible story with a gal that came in with what's called interstitial cystitis and recurrent bladder infections. And that often happens as folks get older, especially in women. That can be a very common finding. But in her case, she had suffered with symptoms of pressure in the suprapubic area and some discomfort with urination, to the point where every time she would even eat, some food triggers, and one of them was dairy, she'd get pain down in her lower abdominal region. So we identified what some of her food allergies were, and we started her on IV ozone, which is taking some blood out, almost like a blood draw, what you give or you get when you take blood. And then you apply ozone gas to that blood and re-enter it. So it's just giving you back your own blood with some supercharged oxygen and blood right back to you. So in her case, we did a combination of IV ozone along with the bladder application. And she is close to complete resolution in symptoms right now. So it's something that she has had bothering her for many years.
I've actually watched YouTube videos on that, and you're right. The women, I don't know, it's a crazy amount. Women suffer with this way more than men. But I have seen some videos on this, and you're going to have to help me with the medical term again. But these women have suffered 10 years with this. They cannot get rid of it.
And the thing is, a lot of times they end up on chronic antibiotic therapy. And what the ozone offers is an opportunity to see if we can reduce microbial load or bacterial load in that environment of the bladder, so that maybe then we can become less dependent on the antibiotics.
Yeah, it's absolutely incredible. And so ozone IV therapy, now thinking about potential for chronic bladder infections, the shots for knees and back and arthritis and things like that. It's a pretty powerful tool, as you like to say, in the toolbox.
Oh, yeah. One of the other really cool things is we call it Prolozone. This is rectal ozone. My friend, Dr. Ng, he is an MD in Michigan. He's Dr. Brownstein's colleague, and he has a big part of his daily regimen that he does at home is rectal ozone for himself. Now, that doesn't really get everybody excited, so that's why we have all these other ways to apply it. But rectal ozone, it's introducing a catheter just slightly up the bottom, and it is a fantastic approach to work on liver support.
Wow.
And again, kind of like bubblegum shrimp, you can go with ozone many different applications. That's what's so cool about it.
Yeah, astonishing. Lots of tools in the toolkit, including ozone, hyperbarics, red light therapy. It goes on and on. We're going to have to head out here this morning, but if somebody's listening to us today, want to talk to you about ozone, wants to talk to you about hyperbarics, wants to talk to you about just feeling better. You like to say thrive, not just survive. Don't just survive the day, thrive. How can they get a hold of you and visit with you about where they're at?
712-339-6024. Again, we've got a complimentary 15-minute discovery call with Mychal Sheridan, Molly, Avery, or myself. Some folks want to take an approach working through reflexive brain work. Some folks want to start the nutrition path with Molly. Some folks want to come directly in and start working with me. We're at 3305 Berkwist Avenue in Spirit Lake. If you're just ready to start and get going and get an appointment going, give us a call. That first visit's an hour long. And we have some exciting pieces and additions coming as the year comes forward here and the summer gets warm. And excited not only for modalities, from exciting other team members that will eventually be sharing the good news with additions on. And so we continue to work forward and offer the hope, the opportunities to work to thrive, not just survive. Movement is medicine. And activating on some of the pieces of movement as well in combination with our local gyms to activate on pieces that folks can do at home. That's going to be another big focus.
Very cool. Dr. Meyer, always a pleasure. Enjoy the phenomenal day today. Great day to do some grounding, I would think.
Beautiful day. I got my feet planted on the ground right outside of Okoboji Wellness Clinic. Beautiful blue sky, and I wish everybody an epic, amazing, joy-filled day.
Thank you, Doctor. Dr. Bradley Meyer with us today from the Okoboji Wellness Clinic. You can find out more at okobojiwellnessclinic.com.